Well, hi, everyone. So welcome to the New Mexico Family Advocacy's 60th ECHO session. As you know, the New Mexico Family Advocacy Program is a model of respondent parent representation being implemented in the 2nd, 13th, and 11th districts. Program utilizes interdisciplinary teams of lawyers, social workers, and parent mentors that provide high-quality representation and the advocacy and support for families in the child welfare system, that need reunification or other preferred outcomes. So my name is Susan Burns. I am the clinical consultant for the program. I've been with New Mexico State. I helped to start New Mexico Family Advocacy Program when I was an instructor at New Mexico State. So a lot of New Mexico letters. And our support is Jen Vieira. So we're going to move in a minute into what we're actually talking about today, but just know, reminders that we'd like to know anyway, who's here. So please enter your name and your email in the chat. There is a post-session survey, which Jen has put up at the start, and we need that as an integral part of our federal grant for the program's data collection. It will only take a couple minutes of your time, and Jen's going to put that link to the survey in the chat box. Also, continuing legal education credits of 1.2 will be offered to participating attorneys by the Corin Wolf Center for Child and Family Justice, which is also that website is in the resource and will be added to the chat. For social workers, 1.25 credits will be offered, and you must email also the link that Jen will put up for social work credits. It's echo nmfap@gmail.com. All right. So today our topic is responsible parenting in the age of legalized marijuana. All right, I have to make sure I get my chats up there. Okay. Our presenter is, hang on one sec. Seem to have lost that document for 1 second. Okay. Is Dr. Colton Larsen, PsyD. And here's his bio, quite impressive. Currently a postdoc fellow with Gold Standard Forensics, LLC in Albuquerque, where he primarily conducts court-ordered and attorney-retained forensic psychological evaluations. Prior, Dr. Larsen completed an APA-accredited internship with the Harris County Juvenile Probation Department in Houston, Texas. While completing this work, he completed clinical rotations in a variety of settings, including emergency departments, forensic private practice. Sorry, Dr. Colton. I have a computer wanting to put a different data. Okay. Forensic private practice, rural school districts, state hospital, a community mental health clinic, where he was involved in pediatric neuropsychology. Dr. Larsen obtained his doctorate and master's degrees in clinical psychology from George Fox University, Portland, Oregon area, and he also holds a master's degree in forensic and legal psychology from Marymount University in Arlington, Virginia. His clinical interests include psychological assessment, forensic evaluation, juvenile delinquency. He has also specialized knowledge and training regarding LGBTQ+ healthcare, fetal alcohol spectrum disorders, and neuropsychological assessment. Outside of his clinical work, he enjoys viewing theater performances, reading urban fantasy novels. Been thinking about what that is. Playing video and board games, wine tasting, and spending time with his 2 cats, and very large family. So our objectives for today We should be able to briefly describe the physical and mental effects of using cannabis, draft effective referral questions for various psychological evaluations for parents who use legal marijuana, access and understand the provided current research on marijuana use relating to parenting. Our wrap, we will start to have a wrap up at 5 to 1, but we will go until 1:15 for those who would like to continue with questions and answers. All right. And I give you Dr. Larsen.
Thank you so much. I appreciate it. Hi, everybody. I'm very happy to be here and very happy to be giving this fun presentation. It was really fun for me to put together, so I'm excited to get through it. As Susan said, we have about 3 objectives that we're going to get through today. The first is just to be able to describe the physical and mental health effects of using marijuana. Under that, we're going to be looking at how it impacts functioning. We're going to look at some myths that are associated with marijuana use. And then we're also going to have like a discussion about implicit bias and attitudes regarding marijuana. And then we will briefly go over the provided research articles that I provided for this training and then, or this presentation. And then lastly, we're going to kind of go over how to draft an effective psychological evaluation referral question for parents who use marijuana. Just knowing, what questions to ask when there are concerns. Throughout the presentation, if you have questions, please feel free to, pop in and say hello, or you can put them in the chat and we'll be monitoring that. There are a couple parts in the presentation that I would like some participation if possible, because that would be greatly appreciated. So we will get started. So the first learning objective is just looking at marijuana itself. So marijuana is, for those who don't know, is just the dried flowers of the cannabis sativa or indica plant. It's this awesome little plant that you see right over here. It's known as, marijuana can be known from different names: cannabis, weed, herb, pot, grass, bud, ganja, Mary Jane. The list goes on. There's a lot of different names, especially when you start looking at different strains and everything. People typically use marijuana, devil's lettuce. I see that one right there. That's another one. The most common ways that people use marijuana is usually smoked, but sometimes it can be mixed into foods like edibles or cookies, brownies, that kind of stuff. And then also people brew them into like teas. I'm not sure in the entire process, but you can also buy like tinctures is what they'll call them. The most common way that people smoke marijuana is through joints, so rolling joints, bongs, which are the big glass things, pipes, and vapes is the more newish one that we've seen so far. There's other methods that people use to use marijuana or cannabis. Usually it's through infused liquids or mixing it into foods. The most common would be edibles like gummies, cookies. I think a common one I've seen, especially when I was in Oregon, were Rice Krispie treats, because you can mix it into the butter. There are about 3 main forms of marijuana that people typically use, especially in areas where it is legalized, particularly for recreational use. You have sativa. Sativa is I call it the Energizer Bunny marijuana. It gives people the energy to do stuff, gives you more of that head high that people associate primarily with marijuana. There's also indica. Indica is I call it the sleeping pill of marijuana. So it kind of gives more of the calming effect, maybe some pain relief, helps with insomnia. And then there's also hybrids of that where it's just a mixture of both the sativa and the indica. And sometimes, it can give you the alertness of the sativa, but then still keep you a little bit calm like the indica does. There are also higher or stronger forms of marijuana that people will use, and it's usually concentrated resins known as hash oil, waxy butter, shatter, dabs. We just had a nice little conversation about what dabs are before this started. Look it up, it's quite interesting. Just to go over a little bit of the science, because again, my background is in neuropsychology, so I like to think about all the things in the brain, of the human brain and everything, so I find this interesting. So the cannabis plant contains more than like 500 different chemical compounds within it, and over 100 of those compounds are cannabinoids, which are the things that we associate most with marijuana when it comes to the effects that it has on the human body. The primary chemical in marijuana that causes the psychoactive effects, so the mind altering, like the high that we talk about a lot with marijuana, is tetrahydrocannabinol, or THC. There's also the other common one that people usually know is CBD, or cannabinoid. And that one's typically non-impairing. It's more associated with other types of effects. As you can see in the picture, I mean, these are just some of the other common ones that you might see, especially if people go into like dispensaries and stuff like that, where they might say high concentration of CBG. That's another common one that's used for pain. Interestingly, fun fact is that cannabinoids were named after the cannabinoids prompted the name for the chemical or the neurotransmitter that's in the human body, which is the endocannabinoids. So everybody in your human body, in your body, you have chemical compounds that are very similar to cannabinoids, or the neurotransmitters, chemicals that are in marijuana. For those who don't know, neurotransmitters are just those electrical or chemical signals that help your brain talk to itself and to the rest of your body. Because cannabinoids resemble and act like the chemicals that are naturally in our body, our brain will recognize those, and then it causes, those signals to fire. Then it causes those different effects that we get from marijuana. So that's why marijuana impacts the human body so much, is because we actually already have a similar type of chemical in our body. So it does that. Kind of makes me think of like when cats, you have catnip, because I always think of catnip as the marijuana for cats. They have, different receptors in their bodies too. So keep this in mind with the, like how our bodies have this natural chemical in them, because it will come into play with other aspects that I'm going to be discussing. Some well-known effects of THC and CBD. For THC, it's mostly the euphoric high, the most common thing that people think of when you say somebody's smoking weed. But THC can also cause impaired memory, altered sense of time, like not knowing, like kind of the time it is. It can stimulate appetite. People always get the munchies after they use marijuana, or THC, I should say. They might have a slower reaction time. Usually call it like the sloth effect. Loss of coordination or balance, so not being able to walk straight. It can also reduce nausea and help reduce pain as well. So those are some other effects that THC can have for different people. CBD, you don't get that euphoric high or that mind altering stuff. You more so get the pain relief, you get the reduced inflammation. Some studies have shown that. Some studies have also shown anxiety reduction, but there's a caveat to that I'll discuss in a minute. It can cause drowsiness or fatigue, or it can help with it, depends on the person. It can reduce appetite, and then it can also help alleviate cancer symptoms like nausea, vomiting, pain that people might experience, especially when people are going through like chemo and stuff. It can be very helpful in reducing some of those side effects from chemo. So some people say that there are some pros to marijuana. Some of those pros I've already discussed. So one of them is pain relief. There have been studies and, just people's accounts that marijuana has helped with their pain if they're experiencing, whether it be, treatment related pain like chemo, or people who experience chronic pain, who have like a chronic disability that causes a lot of pain in their body. It's been shown to help with that. Stress relief, this is where the caveat comes in. So marijuana can help with, somebody say something? No? Okay. Marijuana can help some people with stress. However, another side effect of marijuana is that it can actually increase stress, meaning like that nervous, the paranoia, the anxiety. For some people, it kind of just depends on the person. It can help improve sleep. Like I said, it can reduce nausea and vomiting, improve appetite, whether that be, reducing it or stimulating it. I know, like for some people who are again going through different kinds of treatments, they might lose their appetite, and using marijuana can help stimulate that. And it actually stimulates receptors in your brain to tell you, oh, I'm hungry. And then also, for some people, marijuana use can result in an improved quality of life, especially for people who are going through cancer treatment. It's also been shown to help some people with seizures. It can help reduce the amount of seizures that they have or the severity of them. Something to keep in mind with marijuana use is that with any of these things, whether it be the pros or the cons, you have to take in consideration the amount that somebody takes, the frequency that they use, if they use it with other types of substances, how they use it, because that can also be edibles can be more potent than smoking it. And then also just biology. Different people have different biology, and so their body reacts to substances differently. So always just keep that in mind when we're talking about marijuana, is that everybody's different. Some people just naturally have a high tolerance, for example. Some cons or downsides of marijuana use, mostly look at different health effects and the risks that marijuana use can cause. So one is marijuana use disorder, or what we say cannabis use disorder. So that's a mental health disorder that is related to substance use that's causing impairment in somebody's life in multiple areas. It can cause other mental health problems, such as, like I had mentioned, it can actually help increase anxiety. It can, cause other different types of mental health struggles like depression. It can, for some people, that can happen. There's been some studies to show that marijuana can potentially impact brain health. I think that's particularly salient for persons who are pregnant and they smoke marijuana or use marijuana. It can actually impact the fetus brain development. It can potentially cause abnormalities or slow growth, those types of things. It can also cause heart health problems. Some studies have shown that it increases the risk of heart attacks. I'm going to assume that that's probably related to smoke inhalation again, and then you go down to the lungs also. Using marijuana can impact lung functioning, especially when you're smoking it, because anything that isn't H2O going into your lungs could potentially be a problem when it comes to health. Driving, it's always risky to use any types of substances, even some prescription medications when driving, because it can cause a danger to yourself and others. And then another con is just there is a potential of unintentional poisoning that's particularly salient for children, especially if children get their hands on those edibles. They look like gummy bears, and so they might eat them like a bag of gummy bears, and that can you can't necessarily overdose on marijuana, but the impact of having so much marijuana can cause a lot of issues like sickness, like poison sickness types of stuff, and even hallucinations can happen if people ingest too much. Before I just go on to myths and everything, just wanted to check in to see if anybody has any questions or comments that they want to make before I keep going. Cool. Well, I will keep chugging along. Again, just if you have any questions, just let me know. So some myths that are associated with marijuana. I find this quite interesting. And when I was doing my prep for this presentation and putting this PowerPoint together, I actually came across a couple that I was like, oh, okay. So one myth is that marijuana does not impact youth like other substances. That is false. Marijuana can impact youth like other substances do. It, depends on the amount of use, how they're using it. It's also, youth can't use it because it's illegal. So that can also cause issues for individuals younger. And also the other part too is that marijuana has also been shown to potentially impact brain development. Our brains are still developing until we're about like 25. Some research has said until we're 30 years old. So using any types of substances can impact the development of brain growth and all of that kinds of stuff. Another myth is that marijuana is not addictive. Marijuana can be addictive. Actually, any types of substance can be addictive. And that's for marijuana, there's two possible reasons why. One is we're going to go back to that natural human compound that is in your body. If you use marijuana enough, your body becomes dependent on producing those cannabinoid chemicals in your brain. And so if you stop using marijuana, your brain stops, your brain is not naturally producing those because you had been supplementing it the entire time, if that makes sense. So your body could become dependent on that. The other part too is that, as with any kind of habit forming kinds of stuff, is that we have a center in our brain that is associated with rewards. And so if you do something enough and it's rewarding to you, it produces something that you like, it causes to develop a habit. And that can happen with marijuana, which means that it can become addictive. Another myth is that marijuana does not have withdrawal symptoms. Actually, marijuana does have withdrawal symptoms, especially for those who are very heavy users. If you don't use, you could start experiencing anger, irritability, just more anger. You could actually get physically nauseous. You might feel restless, more anxiety. Cause tremors, weird dreams, those types of things. So that can be interesting. And yeah, a lot of people.
You see the question, Dr. Larsen?
I do. Yeah.
Okay.
So question is, any idea how long it might take for the brain to get back to normal post-use for heavy users? I don't have an exact timeline. I would guess that it takes, quite a while for the brain to get back to it. I feel like with a lot of substances, sometimes they'll say 6 months. It could take up to 6 months for your brain to really catch up. But I don't have a timeline off the top of my head right now. So I'll have to look into that because I am curious about that now. Some other myths is that, people will say marijuana is safer in hazardous situations compared to other substances. I already reiterated this. Any types of substance that, is mind altering or can cause cognitive effects can be potentially hazardous in different situations, particularly like driving. Some people will say marijuana is safe to use during pregnancy. I already went over this. It actually can cause potential birth effects to the fetus. Secondhand inhalation is safe. Yeah, again, going back to anything that's not H2O going into your lungs could potentially be hazardous. And so even secondhand smoke from marijuana can be hazardous because there are different kinds. As I said, there's other compounds in marijuana besides cannabinoids. Some of those compounds are similar. Yes, birth defects can happen. Marijuana has other types of compounds that are also found in products like tobacco that have been shown to cause issues as well. People say smoking marijuana is not as bad as smoking cigarettes. I think I just kind of squashed that a little bit. Marijuana can be hazardous to your lungs if you're smoking it. A lot of people say that marijuana leads to crime. There really isn't any research out there to particularly say that marijuana causes people to commit crime. Now, there is research out there to say that a lot of offenders have used marijuana. So there is some type of relationship, but it's not, we can't say that it is a cause. Usually it's because you need to look at other factors of an individual's life that may be contributing to things. So marijuana does not lead to crime, but it can be part of somebody's story if they are legally involved. Another myth is that most pot smokers are heavy users. That's actually false, not especially in the age of legalization. A lot of people use it recreationally, almost like you would drinking a glass of wine at night. So not every person who uses marijuana is a heavy user. Okay, so this part is the one where I would love some, comments or just thoughts as I go through explaining this, because I think that this is a really important thing to talk about when it comes to marijuana, which is thinking about our own implicit bias that we might have about marijuana. So an implicit bias is essentially kind of like an automatic bias that we have that affects how we judge things, make decisions, and our behaviors. Usually they're unintentional, like you don't intentionally have this bias. It is one that's just kind of inherently in your brain based on your experiences through life. So in thinking about marijuana, I was actually thinking when I was making this presentation is thinking about how people's attitudes and implicit bias may have changed, or how people view marijuana now. So one of the first questions I had was, how do you view alcohol, given that alcohol is legal and people who are 21 or older, whatever the age range is in your state, people who can purchase alcohol, that's fine. In my head, I think, if you're just drinking alcohol on the weekend with your friends, going out boating, you get a cold brewski kind of thing, I don't have an adverse reaction to that, because that seems very normalized in our society. But then kind of ask yourself the same question: how do you view marijuana? Is somebody let's say somebody, we'll go back to the wine example, a lot of people, when the day's done, kids are in bed, they might have a glass of wine just to unwind. And that seems pretty harmless for most. So what about people who might do that same thing, but instead of a glass of wine, they have a couple puffs of a marijuana vape? We have a different reaction to that compared to alcohol use. So it's just a very interesting kind of conversation. And I don't know if anybody has any thoughts about that. If you've seen your stance change, or if you're kind of oh, wow, I never thought of it that way. Yeah, I think experience contributes to perspective. I think most definitely. Yeah, I think that is 100% correct. You can even think about, again, my other example with alcohol, which is your experience with alcohol can also contribute to your perspective. If somebody has, alcoholic parents, they're going to look at people's alcohol use differently than other people would look at alcohol if, it was just kind of a every now and then kind of thing in somebody's family. So yeah, definitely. I think the other thing that I will pose as we're thinking about this is, when thinking about medical marijuana, so a lot of people use medical marijuana to help with pain relief or to help with negative symptoms of chemotherapy. And some people might still have some potential, because the old thought before legalization even happened, marijuana was an illicit and illegal drug. You weren't supposed to use that because that's bad. But now it's becoming legalized. And thinking about marijuana as a pain relief, like you would looking at opioid use for pain relief. So prescription opioids, I can never say that word the best. Do you see them differently? Do you see marijuana as a little bit more bad than if people were using that for pain relief, as compared to maybe using some type of prescription medication for pain relief. Does your perspective change? Yeah, natural alternative. Yeah, so I think that's like one of the I think we're seeing a lot. I mean, I lived in Oregon for 4 years during my graduate training, and where marijuana is very much very, very legal. And that's a very common thing that I heard a lot of people, which is, marijuana could be a natural alternative. Yeah. The last question I'm going to pose to you is, and I think this is really big, which is, how would you view a white individual versus a Black individual using recreational marijuana? Do you look at those individuals differently? So let's say, Mary walks in, she's white, and says, and you're having a chat, and she says, oh yeah, I used a little bit of marijuana to help me go to sleep last night. And then flip that, another Mary comes in, but she's Black, and she says, oh yeah, I used a little bit of marijuana last night to help me sleep. Do you look at those individuals differently because of a potential implicit bias that you might have that is just kind of like in your brain? You're not intentionally doing it, but you're thinking of those individuals differently because of things like systemic racism and all of those kinds of things. I think this is a very important thing to think about and discuss, because the trend has usually been that Black individuals who use marijuana are viewed worse than white individuals who use marijuana, whether it be medical or recreational. So I don't know if anybody wants to comment on that or have any thoughts about that. Okay, well, I want just, kind of think about that kinds of stuff, is about just think about like how do you view marijuana now that it's legalized? Like, do you still kind of get like oh, that's a bad thing, when you compare it to other types of legalized things that people can use for different purposes, whether it be recreational or medical? Just a fun little tidbit. This was done in 2022, but just to show kind of where people's attitudes might be right now. So about 59% of US adults think that, have a positive attitude towards medical and recreational marijuana, 30% only medical, and about 10% said it should not be legal in any case. So
Dr. Larsen?
Yeah.
We have a comment that someone thought for a while about your question about the whole racial cultural differences. With war on marijuana started by Richard Nixon, applied against Hispanics and African Americans, I suppose in a greater percentage wise. So
yeah. I mean, I feel like that really kickstarted a new pattern of these implicit biases, like whether it was intentional or not. Like, I think because of that, what happened with the war on marijuana, that caused people's attitudes to change. And hopefully maybe we're seeing, based on at least this survey that I'm showing you, is that people's attitudes might be shifting a little bit, but who knows? Okay, so just because I want to watch the time a little bit, we're going to go through these articles really quickly, just to go over the articles that I provided for this presentation. So the first one was called Causal Effects of Cannabis Legalization on Parents, Parenting, and Children, Systematic Review. That essentially just means that they looked at all the research that was out there based on certain criteria and just seeing what the consensus is. Based on this, they essentially found that legalization of marijuana likely increases new mothers to use marijuana while they're pregnant or postpartum. legalization has increased parental use or adult use, and it has shifted attitudes about the approval of adult use. Based on their research, there was inconsistent outcomes of adverse perinatal outcomes. I think part of the thing is that there really is just not a lot of research about this, and more stuff just needs to be done. And I think that's essentially what happens with all research, is that more needs to be done. There wasn't a consensus on like how marijuana was stored in the home, what parents thought about adolescents using it, like teenagers, how marijuana affects parenting, how it affects child abuse, neglect, and then other different kinds of child outcomes. And that was just based on looking at all the research that they found in this review. They did find that legalization contributed to more pediatric exposure, which was then linked to a lot of ER visits. Again, going back to the whole edibles look really enticing because they're gummy bears and you eat too much, and that can cause a lot of issues. The other second article that I looked at was just the medical marijuana use and parenting. This was a qualitative study, which means they mostly did like interviews with parents just to kind of get more of like human responses rather than statistical like responses. So a lot of the parents in this study reported that they were using marijuana to help them be calmer and more patient with their children, which can be potentially problematic in and of itself. However, a lot of them did not want their children using it, even if they had a belief that marijuana wasn't as harmful as other substances. So I think that is important to note, that even if they, they still didn't want, even if they were users themselves, they still didn't want their children to be using, even if they thought it wasn't that bad. In the study, there was mixed approaches on how to address parental marijuana use. So whether it be like hiding it from your children, like waiting until they go to bed type of deal, or having open conversations with them to keep the lines of communication open, kind of mixed. And it might just depend on the family, honestly. Yeah, exactly. Yep. Just like people not wanting their kids to drink. I mean, it likely is mixed because people have different approaches on how to have that discussion with kids, whether it be, we just won't drink around the kids, or let's have an open conversation about what drinking is, when is it appropriate, and when is it not. Families are different, and I don't know if there will ever be a consensus on the most appropriate way to do that, honestly. There's a lot of reasons to use medical marijuana. Most people reported it was for pain, some stuff for like mental health, stress-related things, and some other potential reasons why people are using medical marijuana. The last study was just looking at the relationship between marijuana, medical marijuana dispensaries, and abusive and neglectful parenting. I think the thing to find from this study, which is quite interesting, and I don't think they had like a full conclusion as to why their results showed this, but correct. Yeah, some children are medical marijuana patients as well. Yeah, I've actually worked with a few kids when I was in Oregon who used marijuana because they experienced seizures really bad, and they found that the marijuana actually helped reduce those seizures. So yeah, I mean, some children are on medical marijuana. With this study, I mean, I guess the two things just to get from it is that past year use of marijuana was related to more frequent engagement and physical abuse by parents. Again, we don't know why the results showed this. I mean, more things just need to be done. However, they found that neglect, like supervisory neglect, was not related to medical marijuana use. And it was actually negatively related to it, meaning that it really was not an issue. Like, if anything, parents were more likely to not neglect their children. Marijuana users were. Yeah, and then I guess the other point to take from this is parents who are already temperamental, so parents who have a predisposition to already be a little bit more irritable and angry, may use marijuana to relax. However, that could be potentially problematic, especially because if they experience the negative effects of marijuana, such as the anxiety and paranoia. Okay. Let's go on to how to draft a psychological evaluation if you're working with a parent who is using marijuana. So just starting off generally, how to make a good referral question when it comes to psychological evaluations. A lot of this stuff is going to be more pertaining to parents who use marijuana, but these guidelines that I'm providing could actually be used for just about any type of referral if you just kind of reword it a little bit. So when thinking about wanting to get like an evaluation done on a parent, you want to provide the evaluator specifics about what you want to know about the parent's functioning, specifics about problems that gave rise to your concern. So like, why is this even coming up? Like, why do you need this evaluation? And then also providing specifics about outcomes or options that will be affected by the findings, meaning like whether the evaluation goes good or bad, depending on what your perspective is on what good and bad is for that evaluation, what's going to be affected by that? Is it going to be custody? Is it going to be visitation rights? Is it going to be those types of things? So it's helpful for the evaluator to know what's the potential outcomes of what this evaluation could be contributing to. As always, it's always important to also just consider what the legal statute is in whatever state you're in, because obviously all states have different wording, different types of statutes that might contribute to whatever the particular problem might be or the issue at hand. And then also just keeping your referral questions to evaluators open-ended rather than a yes or no, because it's usually never clear-cut as a yes or no in psychological evaluations. So let's look at an example real quick. So a typical referral question that people might get when it comes to like parental capacity or their, like a parent's ability to take care of their children. A typical one that people might see is, what is the parent's caregiving ability and what services are needed? That's an okay referral question, but we could actually break that up into 3 separate questions that make it a little bit more specific and more helpful for the evaluator to know what they need to do to help you kind of figure out what to do. So the first question would be to this example would be, what strengths and weaknesses do the parents have in terms of their ability to care for their child? Given that they have a history of cannabis use, for example, or mental health problems, what, if any, substance use or mental health services are recommended? And then, are there concerns about the children's safety during family time? And if so, what indicators should be monitored before, during, or after family time? So see how those we went from a very simple just not too much information to breaking that down into 3 really good referral questions that you could send to an evaluator, and the evaluator would know what direction to really go down. So we're going to practice. So I'm going to read a scenario to you guys. And then after I read the scenario, then I would love people in the chat to maybe, put out what are specific referral questions that you might have for a case like this. Just to get kind of like a hang of what it's like to give the good referral questions so that you get a good evaluation. Okay, so the first scenario is Miss Cheryl, a single mother, picked up her 3-year-old daughter from the small town daycare. On their way home, Miss Cheryl ran a stop sign and was subsequently pulled over by the police. During the routine stop, the officer noted that the daughter was properly placed in her car seat, and Miss Cheryl appeared distracted and anxious. Due to her suspicious behavior and a smoky odor that was coming from the car, the officer requested to search her car and belongings, which she agreed to. Upon his search, the officer discovered a roach, which is like a little burnt end of a blunt. Or a joint, sorry. He discovered a roach in Miss Cheryl's purse, which smelled of marijuana. The officer also observed Miss Cheryl to have very red eyes, difficulty following directions, and she appeared extremely distracted. Because of this, the Child Protective Services were called to take her daughter due to suspected child endangerment related to substance abuse. So now you are on Miss Cheryl's case. And you determine that you want to get a psychological evaluation to help potentially see if she's able to get her child back, or if there needs to be, stipulations in place or anything like that. So what referral question would you like to know?
Dr. Larsen, I'm not gonna be able to write this question down, so I'll just speak up about it. I'm wondering about clearly she had some physical signs that looked like something, she had perhaps smoked something, but the fear of being stopped by a cop, the fear of being caught with a roach in your purse, the fear of all the things that we know now are different in society because of the legalization. I would want to separate that. I mean, clearly good safety precautions around the kid, but so how do you separate out those kinds of things from her I mean, you can't, it's not going to be red eyes are not going to be from fear of a cop, but anxiety and panic, that could easily be there.
Yeah. So, I mean, I don't know. I have thoughts on what would be like a good question to what you're saying, but I want to see if anybody has any thoughts on how to phrase that as a question.
So Colton, for me, I would be asking more about her anxiety in general. So, is it diagnosed anxiety? Is it something like how large or what things does anxiety keep her from living everyday regular life? So my question is going to be, can you tell me a little bit about your anxiety?
Yeah. And
what you experience when you're having anxiety?
Good. Yeah. And I think that goes right along with of the first part of the questions that I would ask based on what Susan just said, which is there the presence of a mental health disorder such as an anxiety disorder, and how has that contributed to her functioning? That might be whether it be daily functioning or functioning to adequately care for her child. And then you can split that up and then also ask a question about asking if there is a substance use problem, and if so, how is it impacting functioning? And
so we have a question, not a question, but a statement from Shasta. To Susan's point, she could very well have just been crying, distracted about something completely unrelated. Maybe she picked up the kid from daycare and was informed that the kid had been bitten, or maybe grandma died, maybe red eyes from allergies, sneezed and ran a stop sign at the same time. Big leap to go to CPS.
Yes. I love that you said all this stuff, because that gives me hope that people are thinking about thinking more contextually about these kinds of scenarios of there's a lot of other things that could be going on for that parent. However, sometimes that doesn't happen when it comes to parents, for example, this kind of scenario. Sometimes in the moment that's not being thought about, or maybe not everybody thinks about those other potential contextual factors. And so then we end up in a situation like this.
Well, also it's kind of an issue of informing law enforcement. Someone think Francis said Leslie said, would CPS have been called if she was distracted by her phone? And then another is, has medical cannabis been recommended for her? Is she following doctor's orders? These things are also triggered by the police's wondering, questioning, not perhaps broad thought, although maybe they can't do that right there at the stop.
Yeah, no, I mean, like, all of these are really good questions, and these might be questions that you might, if the case gets down to it where you need to get an evaluation done to see if a parent could, see what their capacity is to parent, then these are questions that you might want to ask the evaluator to touch on. Or it could be information that you can gather from other sources. For example, like the medical cannabis. I mean, if you're working with this individual, you could, see if they do have a prescription for it. What is it for? Those types of things.
And Shasta's my lawyer. She said, I'd object to an invasive psych eval on these facts anyway.
Yeah.
So. Yeah. Yeah. So, and then I just saw that Kristen put in, we have heard about people getting stopped for any type of pot in the car, and it leads to a referral to the different agencies. So sadly, I mean, I would say we hope that it's not happening, but it probably is happening in some cases. I will say that it's about 5-1. So, we're good. Continue. If people need to drop out, they will, but we're able to continue.
Cool. Let's go on to the next one, just to see what people's other thoughts are about, what kind of referral questions would you want to ask for this type of scenario? So little Timmy was recently taken into CPS custody because bruises were found on his arm while he was at school. There was concern of substance use by his mother, Miss Griffin, and she frequently presents as anxious, depressed, and distracted. At the adjudication, Timmy was found to be an abused child, despite the results of a drug and alcohol assessment not being ready at the time. Subsequently, Timmy was placed with a relative. Sometime after that adjudication, results of the DNA assessment showed no issues related to the overuse of alcohol, which was a major concern. However, the evaluator who did the DNA questioned marijuana dependence for Miss Griffin. An initial judicial review is coming up. So what questions would you want to know that might be helpful when it comes to parenting?
Well, I would wonder, marijuana dependence, that's different than marijuana use. And so it's not clear what amount of marijuana she's using just from this scenario.
Right. Yeah.
But you wanted a question. Okay. Lawyers, anyone?
Bruises come from? What story does mom tell? Yeah. Is that, when it comes to where did the bruises come from and what story does mom tell, is that a question that you would want, for example, a psychologist to ask that person in an evaluation? Or is there other information that you want to know?
A good question here is, does marijuana dependence typically lead to physical abuse of children? ? That's from Francis.
Yeah, I think that's a good question, is there anything out there that says, are the two related in some form or way?
So Colton, for me, I feel like even our biases are coming up here. And the fact that the focus and the goal is, for me, is the bruises. What happened to the child? What is the parenting style like? What is the home environment like? To me, a conversation about cannabis use that really is not going to be one of those first thoughts, one of my first questions. It's something that might come up later, but looking at their strengths or their weaknesses, I want to know about the parenting. If a mom can tell me, oh yeah, he fell Tuesday, because he was playing on this, then that gives me that inclination that mom is attentive. She saw it. She knows what happened. She's not inside the house or in a whole nother room getting high and not knowing what her child is doing. And so for me, I think even a bias right away, that's not what we should be talking about first. We should talk about the bruises and the physical marks on the child.
Yes. Yeah. I think definitely. I see maybe to like go off of what you just said, like a good thing to ask, and it's kind of popped up here in the chat, which is what is the relationship or the possible relationship between the bruises and the marijuana use? Like, is because the DNA evaluator had questions about marijuana dependence because of this, random drug assessment that was done, maybe having an evaluation done to see, is there actually marijuana dependence, and is that impacting, like you said, certain scenarios in the home? For example, were they so high on marijuana that they did not notice that their kid fell down and was crying for 10 minutes? Like, is that an issue? Is it impacting their ability to parent their child? Obviously, there's other things in this kind of scenario that comes to like parenting style, attachment, even, like those kinds of things. But but when thinking about like substances, we want to think, is that also impacting how things are going, or is it not? Because maybe it's not. Because again, I think I go back to, maybe this mom, the evaluator had questions of marijuana dependence because the mom reported that she has used marijuana and that's it. Maybe the mom has used marijuana like a glass of wine at night when the child is in bed watching a movie and like falling asleep, and she's just trying to relax for the rest of the night before she goes to bed herself, kind of thing. So yeah. Great. Any other thoughts? Cool. So I'm going to leave it open-ended for people if you have questions, not just about like, these practice scenarios that we went over, but if you have other questions about marijuana or people's functioning on marijuana, I'll try to answer them the best I can.
Colton,
Yeah.
how would what's it called, marijuana dependence or use disorder? How would that manifest as opposed to someone who is smoking pot on a more limited basis? I mean, what's the dividing line that we're looking for from a dependence to an occasional use?
Yeah, so I think the big thing that you would be looking at is it causing impairment? And what I mean by that is it causing issues in their life? Meaning, is it impacting their work? Is it impacting things at home? Is it impacting other things, like let's say a young parent is in college, is it impacting their school? Like those kinds of things. So you're really looking at impacting financial problems. Like, are they like so need the marijuana so bad that they're not getting their basic necessities like clothes and food and water, and spending that money on buying marijuana because they just really need it? That's when it becomes a really big issue, is that it's impairing their life in some way. When it comes to like like with what I do, when it comes to like diagnosing somebody with a cannabis use disorder, there's other set criteria that people have, like, did you build up a tolerance to it? Did you start using in larger amounts as you kept going? Did you try to stop and it didn't work? Those types of things are other things that we look at as well when it comes to like actual diagnosis of those things. But when it comes to dependence versus every now and then recreational use, you're really looking at, is it causing impairment?
I know back when I was directly representing parents, we would frequently see marijuana being brought into the mix because the kids had access to the substance. I think I saw that more frequently than just the fact that the parent was using.
Yeah. Yeah, and that's I think that's another thing to take into consideration is what is the access like for the kids? And I always think about like, what can we do to try to like help with that problem? And that could be, talking with the parent and talking about the solutions of how do we make sure the kid doesn't have access to this? Do you need a lockbox? I mean, a lot of people actually do buy those when it comes to like their medications. They actually buy like a lock, like a true locked box to put their medications in so that their children can't get into them, or if they have a family member who has some type of substance problem, they might lock them up just to make sure that they're safe.
So we have two here. One is that if a referral is needed, who can we refer to? And also, Chester asked, I've heard more gateway drug arguments in the last 6 months than in the last 10 years. Is there a new campaign?
Okay, let's see here. Well, when it comes, I hear the gateway drug argument a lot, and in reality, I don't think that there is any like research that says whether or not marijuana, like you smoke marijuana, you're going to go do this other stuff. You're going to go smoke meth. Like the second you take marijuana, your next step is meth. Like there's just really is not any research to support that is how that works. Because you also have to think contextually of, I think people forget to think about other areas of people's lives. There is a potential reason why people go and use other substances. And that could be home life. It could be trauma. It could be modeling from parents who are using really bad drugs. And I feel like the gateway thing comes up a lot because it's, compared to a lot of other drugs, it's a little bit more easily acceptable, especially for kids, than some of the other stuff. And so people are, jump to saying that it is directly a gateway drug, when I don't think it is. That first question, if a referral is needed, who can we refer to? I'll say on my end, because we work in private practice, so you could potentially find somebody who works in the community privately, who does evaluations that are associated with either mental health or parenting. I don't know about specific agencies within New Mexico. I'm new to New Mexico, so I don't know like any specific agencies. So I don't know if Susan or Kristen or anybody has any thoughts on that.
So one of the consistent things that we've heard about, and when Dr. Bravko has spoken with us previously, there's a large disconnect between what the state can pay for assessments,
Yep.
As opposed to what is really being charged for good assessment. So there is an issue there, but I do think it would behoove us to continue to reach out to other forensic evaluators to see if someone is willing to work within that. And I'm assuming then that question is about the referral. That's about evaluation as opposed to treatment. Is that correct, Shonda?
Sorry, so there was two different questions. So one was like, who do I give that referral to? Who do I see a need and I'm asking those questions, who do I refer to? But my second question was, so one of the statements was, if parents are consuming and their children know about it, to talk with the children openly, communicate, or do you have any strategies on doing that? So how do you talk to a preteen or, a younger child whose parents are consuming marijuana, but we want to handle it in a way that's informative, those types of things? Do you have any strategies for that?
Yeah. The first thing that comes to my head is, I'm so happy you asked this question because I worked with kids a lot. That's a lot of what I've done in the past. First thing that popped in my head is that kids, especially teenagers, they know more than you think that they know. And you can actually talk to them pretty upfront more than you think you can, meaning you don't necessarily need to skirt around the topic. You can actually just directly say, like, just be very direct with them. Like, maybe start with, what are your thoughts about marijuana? Because even kids have their own opinions about it. You could like say, have you ever, seen somebody use marijuana, or what do you think it does to you? Open that conversation with them, and then provide some education, like, hey, marijuana can have like these effects on people. Explain those types of things to them. You don't need to use like super fancy words with kids, like cannabinoids and your endocannabinoid system in your body, that kinds of stuff. You can just say, hey, you got some chemicals in your body that are like exactly like the chemicals in marijuana, and they act like each other when you do it, and then it causes these things. And then I think just having that, I always think of like a straightforward conversation, especially with preteens or teens, because I don't know, part of me thinks is that they probably know more about it than the parent does or the adult does, especially in this day and age. So yeah, and I think it would be the really, really important part about when working with kids is giving them the space to ask you questions without repercussions. I think that's the really, really big one, is that when you're having these difficult kinds of conversations, whether it be about marijuana, alcohol, that kinds of stuff, is giving them the ability to ask whatever questions are on their mind, and not, punishing them for maybe things that they ask, giving them that space to actually just be kind of open and honest and ask the questions that they want to know about. And sometimes there are questions that are like, they're so scared to ask, but then they ask it and you're like, that wasn't a big deal question at all. Yeah.
So it looks like we have one last question, and it's a doozy. We have about 5 minutes, but Leslie stated one of the issues that comes up with alcohol abuse is related to child abuse, is that it reduces the perpetrator's inhibitions, especially say in sex abuse cases. What is the impact of marijuana use on this? And she's just said that she was surprised that the correlation between marijuana use and increased physical abuse. So the issue is, does it produce the same inhibitions?
I mean, I would say it can, potentially, but again, it also goes back to that first thing that I had. One of the first things that I had said is, let me find it, is considering the amount taken, the frequency that they use. Like, we need to consider those things as well. But I mean, I won't lie. I mean, marijuana can cause inhibition problems. It can cause people to, do things that they otherwise wouldn't do when they're not using a substance. And I think that's kind of goes for not just marijuana, but for other substances. And that can include certain prescription medications. Like, I mean, I think that's the thing people don't realize, is that most substances can cause these issues.
It's probably true in any medication or any substance taken in excess could probably do that.
Yeah. And then I think the other part I will just throw out there is that, along with like the possible effects of losing your inhibition when on marijuana, you also have to think about, again, the temperament of the person, their predisposition to be aggressive, for example, because it's not, there's a lot of people who, for example, drink and don't abuse their children. So again, there's a lot of people who use marijuana and don't abuse their children. But we have the big issue of, there are also people who abuse alcohol or abuse marijuana and do abuse their children. And you kind of have to look at all of the factors, not just their substance use.
Well, thank you, Dr. Larsen. This has been great. And we appreciate your time.
Yeah, thank you so much. I really appreciate it. I have just going to let everybody know that on my slides, I've left up my work phone number if you need it, or my email address. is on here, and I know that the PowerPoint is accessible online for people to get. So my information is on there, and then also my supervisor, Julie Brovko, is also on here just in case you want to get in touch with her as well. She's been in New Mexico for quite a long time, so she also knows the ins and outs of how New Mexico works with a lot of things too. Thank you so much.
While Dr. Larsen was talking, I found an article from the National Library of Medicine, National Center for Biotechnology info that talks about the teratogenetic, if I'm saying that correct, effects of marijuana. This is the first time today that I have ever heard that birth defects were possible from marijuana use during pregnancy. So thank you for that. That's a huge thing. And it's a very short article. If you look at that, in fact, I'll stick it in the chat again, but if you look at that, they're small studies, Australia, Hawaii, but there are some specific defects that were elevated, including changes to hands and arms, neurological issues, orofacial clefts, Down syndrome, cardiovascular defects. So it's actually some horribly profound impacts that could occur. And I think that more folks that could become pregnant need to know about that. I was quite shocked by that.
Yeah, I always tell people essentially is that if it's not naturally in your body and not something a doctor would say to tell you to use, then it's probably going to cause some problems. There's a reason why in my evaluations I will ask, like, not only have you used alcohol, cigarettes, marijuana, other substances while pregnant, have you used other medications while you're pregnant? Because there are also medications out there that can cause issues. So it's quite wild, the amount of things that can cause birth defects.
Yeah, I'm of the thalidomide, I'm not saying that right, that generation of babies being born, that was a great medication till it wasn't.
Yep.
All right, well, thank you very much. Hopefully we see you again.
Yes, thank you so much. I really appreciate it.
Okay, bye, everybody.
Bye.
Thank you. Gonna stop the recording now and everything.
Okay, all right.
Have a
Bye,
good day.
Caitlin.
Bye, Caitlin.
See ya. Thanks, Colton. Bye-bye.
Yeah, thank you so much.
Thanks, Colton.
Of course, thank you.